that is face, and I have already finished the head, and now we will come to the face, diseases of face, congenital anomalies of face. And so we are just giving in the face the cleft lip and cleft palate is the most common congenital anomalies in the face. And face is developed, the embryological aspects of the face, how face is developed in the embryonic life. Just in the 8th or 6th week of the embryonic life, there is the opening appears in the cephalic end of the embryo, that is called mouth, primitive mouth, or osteomedium. This osteomedium, that is in the cephalic end of the embryo, the cephalic end, that is the primitive mouth edge, is surrounded by 3 processes, that develop from the whole of the face, develop from the 3 processes in the intrauterine life at the 10th or 6th week of the intrauterine life. The frontonasal process that appears in the around the primitive mouth, and this frontonasal process give the development of the premaxilla and philtrum of the lip and the upper jaw. The frontonasal process, there is a pit in the center of the frontonasal process that divides, that forms the nasal pit. This nasal pit is divided into the 2 parts, that is the lateral and medial. Medial part of the nostril, that is the septum of the nose, while the lateral division forms the lateral part of the nose and the floor of the nose. So the development of the septum of the nose and side wall of the nose, and the philtrum of this one is called philtrum, and this philtrum and the upper jaw develop from the frontonasal process. Now the second 2 process appears, that is maxillary process, and this maxillary process from the both sides, there are 2 in numbers, and from both sides it unites in the middle, and uniting in the middle forms the upper lip except the philtrum, because the philtrum is formed by the frontonasal process. So the maxillary process in the developmental period combine in the middle and forms the upper lip, except the philtrum forms the upper cheek and also forms the upper jaw and palate. In the maxillary process, there is palatine 2 palate process, and this 2 palate process combines to each other and form the hard palate and soft palate. That is, the palate is developed from the maxillary process, and the plate of the maxillary process uniting in the midline, and in this way the maxillary process gives the development the upper lip except the philtrum, the cheek, upper cheek, and the upper jaw and the palate. The another 2 process, that is the mandibular process, that is lower part of the face, is developed from the mandibular process combined in the middle of the chin, and then it forms the upper jaw, forms the lower lip, and forms the lower part of the face. So in this way, the embryological development of the face takes place in our embryonic life, and in this way you must know that the nasal palate is developed in two groups, that is the premaxilla part, develops from the interior to the, and this premaxilla is also called the primary palate. And the secondary, it is anterior part of the incisive foramen, and the posterior part of the incisive foramen called the secondary palate. Now come to the how the congenital anomaly takes place in our lips and the palate. Cleft lip, cleft means that is the tear, that is the knot uniting in the medial part, is called cleft lip. That is this cleft lip is occurs in the entire life, and it is due to the failure of the fusion of the frontonasal sinus, frontonasal process with the maxillary process. Because the frontonasal process and maxillary process both unites to form the upper part of the lip, that is the philtrum, and the rest part of the lip. So when this frontonasal process and maxillary process is failed to unite in the middle, then the upper lip is not formed properly, that is lip is cleft, that is also called the hair lip. Hair means rabbit, that is the lips of the rabbit is broken, or you can say tear up. In this way, when the union doesn't take place in the entire life, the frontonasal process and the maxillary process, then the defects in the development of the lip take place and forms the cleft lip. So you can define the cleft lip, that is failure of the frontonasal process which the maxillary process forms the cleft lip. Similar to that in the palate, when union doesn't take place in the middle of the palatine process, with the both palatine process of the maxillary process, when doesn't unite in the middle, that makes a cleft, that is the space between the two sides of the hard palate and the soft palate, that makes the cleft palate. So you just know the cleft palate is the condition in which there is failure of fusion of the both side of the palatine process of the maxillary process, and so the cleft palate is formed, and patient will born with either cleft lip or cleft palate, or may develop the both together, that is cleft lip with cleft palate. The incidences of the cleft lip, that congenital anomalies, that is not so high, but cleft lip only takes place in the 600 birth, 1 in 600 birth, 1 in 600 birth, the baby is born with cleft lip. But in case of the palate, the incidence is less, and it is only one baby is born with cleft palate in 1,000 live birth. So the incidences of the cleft lip is higher, that is the 1 in 600 birth, but cleft palate is only 1 in 1,000 birth. Now the sex ratio, that is the male, is suffering more than the cleft lip. Cleft lip is common in the male, and cleft palate is common in the female. So you can say that the male suffer from cleft lip more, and female develop cleft palate more. Now if you will decide, if you will enumerate the incidences of the cleft lip and cleft palate, you can say that the cleft lip only 50% of the all congenital anomalies, and the cleft palate is the 40%, and both cleft lip and palate is 45%. So the cleft lip is more or less associated with the cleft palate also, and both incidences is more, that is 45%. Only the cleft lip is there only in 5%, and it is more common in male. The only cleft palate is 40%, and it is common in female. What are the etiological factors that lead to the non-union or failure of fusion of this palatine process and forms the congenital anomalies of the lip and palate, that is the cleft lip and cleft palate? The etiological factors can be divided into two groups, that is the genetic factor. Genetic factors, that means if the mother or father, if the parent suffer from cleft palate or cleft lip, the incidences rises in their offsprings, cleft lip and cleft palate more. And so there is some genetic factor. If father or mother is suffering from the cleft lip or palate, chances of being cleft lip in their offsprings is more than than the normal one. So the genetic factor also acts in the development of the cleft lip. Not only this, the genetic factor is also assisted with so many congenital anomalies of the infant. The another factor is the environmental factors. That environmental factors consist of the rubella infections in the first trimester of the mother when mother is pregnant, and then rubella infection takes place. The baby can be born with this congenital anomaly, that is the cleft lip and the cleft palate. Some age diagnosis, if the pregnant mother is not taking proper food or not malnourished, there is a vitaminosis, and mostly the vitamin A deficiency can cause this congenital anomalies, that is failure of the fusion of the frontonasal process and the maxillary process, and develop the cleft lip and palate. The another is the hypoproteinemia, that is when protein level that is in the blood is less than the normal one in the case of the pregnant mother, because the pregnant mother requires more and more proteins, and if protein is not taking the proper amount, then hypoproteinemia will be occurs, and this hypoproteinemia is also supposed to be the physiological factors of the cleft lip and cleft palate. Anemia is the another factor also, and also some drugs. If in the first trimester, if the pregnant mother is taking the drugs like pentoin and diazepam and other things, then it may be possible that the child will suffer with, the baby will born with the cleft lip or cleft palate or the another associated with any other congenital anomalies of the face. Now come to the pathology. What's the pathology? In case of the cleft lip, that is the hair lip, it is also called the hair lip. It can be either unilateral or bilateral. Most of the cleft lip is unilateral only, and not unilateral only. On the left side incidences is also more on the left side. So the cleft lip mostly occurs in the upper lip on the left side, but can occur also on the right side also, but in incidences on the left side is more. The unilateral cleft lip is either may be complete or incomplete. Complete, that is unilateral complete cleft lip, is that the cleft lip is also associated with the incomplete fusion of the alveoli, and then the alveoli and it extends up to the alveoli and the nose is broadened out. But when only the lip is cleft, that is, it doesn't extend, it doesn't broaden up to the nasal cavity, then it is called incomplete. So the unilateral cleft lip either may be complete or incomplete. Maybe bilateral. Bilateral means that they may be on the both side of the lip, but the incidence is very low, and in this condition there is flattening of the nose and protruding of the premmaxilla. It can be either partial or complete. Total white of the lip on the left side is cleft, or the partial, that is only part of the white of the upper lip is cleft, then it is called partial. So the cleft lip either may be unilateral, bilateral, may be complete or incomplete, may be partial or complete. Similar to that, the cleft palate. The cleft palate is now before considering the cleft palate, the palate develops, can be divided into the two parts, that is the primary palate and the secondary palate. Primary palate is that part of the palate that remains anterior to the incisive foramen. That is incisive foramen in the palate. There is a small slit, triangular, and it anterior to the slit is called primary palate, and behind this is the secondary palate. The cleft lip, and then the primary palate, cleft lip can be occurs also, and secondary palate of the lip, the cleft can occur. So now how will you classify the cleft lip? The cleft lip can be classified, that is maybe cleft lip alone, only the lip is cleft and it is not with the abnormality or the cleft of the palate. Second, maybe either cleft lip of the primary palate only. I have already mentioned that the two parts of the palate, anterior part is the incisive foramen, is called primary palate. So when the primary palate, when cleft, it's called cleft lip of the primary palate, and the part of the palate posterior to the incisive foramen is called the secondary palate, and this secondary palate can be cleft, and so it can be said that the cleft lip of the secondary palate. Not only this, it can be both, that is the primary cleft of the primary palate and cleft of the secondary palate, both remain cleft, and there will be in the upper part of the mouth, if you ask the patient to open the mouth, there will be complete non-union of the both sides of the polyp in the floor, in the roof of the mouth. And so there may be cleft lip of the both primary palate and the secondary palate. And fifth one is the cleft lip and the cleft palate, both associated, is more common than the other types of the cleft lip and palate. So you can classify the cleft lip and palate, that you can say cleft lip alone, and again you can divide it into complete or incomplete, unilateral or bilateral. Similar to that, you can also say the cleft of the primary palate, and it may be also complete or incomplete. Similar to that, the secondary palate, it may be either complete or incomplete, and maybe cleft of the primary and secondary palate both, and it may be either cleft lip or cleft palate. So these are the five types of the cleft lip and palate. I can classify in this way depending on the extent of the cleft to the lip and the palate. Now come to the clinical feature. What will be the clinical feature of the child when he is suffering from the cleft lip and palate? The buried parent means it can be diagnosed. The cleft lip can be diagnosed in the intrauterine life. How you can diagnose the cleft lip in intrauterine life? Just you do the ultrasonography. You can do the intravaginal ultrasonography, or you can do the ultrasonography of the lower part of the abdomen. In the pelvis, you will the ultrasonologist easily diagnose the cleft lip, and when the parent will know that the child or the infant developing in the womb is having cleft lip, then it becomes buried. But he should be, or they should be born that it is completely, if only the cleft lip is there, it is completely curable by the surgical method, and let the pregnancy to be continued. But if there is another congenital anomaly associated with the cleft lip, and then you can terminate the pregnancy, and you can save the mother giving the birth of the congenital anomalized baby. And so if only cleft lip is there, you advise the parent that continue the pregnancy. But when it is associated with the other congenital anomaly, it is better to say that terminate the pregnancy. Similar, so the parent is buried, and you may counsel the parent efficiently. Now there is difficulty in sucking. When baby is born with the cleft lip or cleft palate, if complete cleft lip is there, there is difficulty in sucking of the teats or the feeding bottles, and then it is difficult. But in case of the partial or the incomplete cleft lip, there is no difficulty in sucking of the teats or the bottle feeding, and so only you can treat this by making bigger slit or bigger hole in the feeding bottles, and then the child will feed or suck the teats or the bottle very efficiently. But if it is associated with the cleft palate, then or if there is complete cleft lip is there, suckling is difficult because the negative pressure is not exerted into the buccal cavity and suckling doesn't take place efficiently. And in this condition, the feeding of the baby should be how is the baby should be nourished. You should give the training, and child or the baby should be sucked or nourished in prone position. There is also difficulty in speech because it is also associated with the dentination problems, and the speech, that is the infant or the child cannot say papa, mummy, other things efficiently, and due to the fact that the air or phonation is not complete, air pass out in case of the cleft lip, cleft palate and cleft lip also. So a speech problem is also there, and so the fourth one is the cosmetic. That is the cosmetic purpose. The child is not looking well, or its female is there, it is very difficult, and so it should be treated properly in the times, and the proper time of treatment is the 10th weeks of the baby, age of the baby. It is also associated with the hearing problem, that is defects in the hearing also in case of the cleft lip and cleft palate, because the Eustachian tube that connects the ear to the buccal cavity is obstructed or shortened, and there is a recurrent infection of the Eustachian tube that will lead to the hearing problem, or the patient or child may be impaired hearing, may having impaired hearing. So these are the clinical features and of the cleft lip and palate. Now we will discuss. So this is all about today. In my next class we will discuss about the treatment or treatment part of this content and anatomy will be discussed in my next class. So I would like to summarize the whole of the session, that the development of the face takes place by the 5 process, that is in the entire 6 weeks of entire time the face development of the face begins, and the cephalic end of the embryo, that in the upper part of the cephalic end develops the primitive mouth. Around the primitive mouth 5 process develops, that is 1 frontonasal process, 2 maxillary process and 2 mandibular process. By all these, whole of the face is developed. The frontal nasal process that gives the development of the premandilla, philtrum and upper jaw also, and the maxillary process develops the upper lip except the philtrum, cheek and the upper jaw and palate. The mandibular process develops the lower jaw, lower lip and lower part of the face. The failure of fusion of the frontonasal process with the maxillary process, or when union doesn't take place in any proper way in the palatine process, then there is cleft lip and the cleft palate, that is congenital anomaly. Cleft lip is the failure of fusion of the frontonasal process with the maxillary process. Similar to that, the cleft palate is the failure of fusion of the both palatine process in the middle. So it forms the cleft lip and cleft palate. Incidence is more in the cleft bilateral, that is both cleft lip and cleft palate 45. Cleft lip only occurs in the 15%, and only cleft palate occurs in the 40%. Sex mostly upper lip cleft is common in male, and cleft palate is common in female. Etiological factors can be divided into 2 groups, that is genetic groups and the environmental groups. Pathology, you can discuss about the cleft lip, unilateral, bilateral, cleft palate, primary palate and secondary palate, and classification you can give the cleft lip alone, cleft palate alone, both cleft lip and palate, and in this way you can classify clinical feature, that is the mother is worried for being ugly to the child, there is also difficulty in suckling of the kids and the breast, and also difficulty in speech. There is also cosmetic problems and hearing defects there. Now come to the treatment point of view. We will discuss in details in my next class. So thank you for today.